Next on the agenda is public presentations. Public presentation is time is intended as an opportunity for the public to give input on relevant issues and not intended as a question and answer period. Ms. Mounts, did anybody sign up?
Yes, Mr. Chairman. First up is Dr. Kearns.
Okay, would you please state your name and address?
Good evening. My name is John William Kearns. My mailing address is Stevens City. I live in the northern end of the county, and I've been a resident of Warren County for almost 40 years. Before I begin, I want to make something clear that I'm not trying to scare anybody. There's been some concern that putting factual material out sometimes may be uncomfortable for some folks. I do want to raise consciousness, and I do want to ask each and every one of you to consider doing what you believe you can do corporately or individually via conversations or written communication to address the issue that I bring to you. I was here last month, so I appreciate your listening to me again. But I want to update you since we actually sat down and met with Valley Health 2 weeks ago. Some of this refers to recent research and recommendations from the American College of Obstetrics and Gynecology and a couple of articles from the Journal of the American Medical Association. I'll leave copies of those here as well as copies of my statement on the counter over there. I believe it's terrific that Valley Health is building a new hospital in our county. I mean, we need it. It looks like it's going to be a beautiful facility in a great place. I want to congratulate them on committing to that in our county. There are two main points for me for tonight. We should urge all concerned to press Valley Health to please partner with local and distant collaborators to continue safe OB care in Warren County. It can be done. We should also insist that Valley Health immediately work with all appropriate county agencies and regional resources in order to identify and address obstetrical and neonatal care issues which will occur with the closing of OB in May. In my opinion, it is their responsibility to take the lead on this since it's the result of their actions. Here is why. First, 27 hospitals in Virginia have closed their OB services in the last 8 years. 3 have had to reopen because of consequences of those closures. However, when Valley Health was asked why not partner with community and other groups to build a state-of-the-art birthing center, combining the best of low and high tech, their response was that it was too difficult to hire and maintain what is needed. This does not reflect the fact that in the past few years they have done quite well and deliveries have grown. An OB who attended the meeting commented there were no OBs who wanted to come to Warren County. I found this odd in light of the fact that he himself had been recruited here and is an excellent addition to our medical staff. It may be that the current Valley Health approach to maintaining the support system for OB is not the best way to sustain such services. That doesn't mean that other approaches won't work, especially if they were to partner with the community and seek input from other localities who have made it work. For example, there are hospitals in Virginia which deliver safe OB and neonatal services with under 300 and some under 200 deliveries a year. Second, with the impending closure of OB at Warren, Valley Health is to be commended for training ER and emergency transfer staffs to handle obstetrical emergencies. But there are other important issues. In order to let Valley Health better understand where people are coming from, we shared with them at that meeting national data from the American College of Obstetrics and Gynecology, or ACOG, and 2 recent articles from JAMA. The ACOG report gave recommendations for supporting healthy pregnancies and deliveries in rural areas. Among their recommendations were that barriers to obstetrical care in rural areas need to be identified and eliminated. Their journal articles looked at what happened when rural hospitals closed their obstetrical services in America. This was a study of over 4.9 million pregnancies, almost 5 million pregnancies. What they found was that out-of-hospital births increased, premature births increased, and that women had fewer prenatal visits to identify and address complications in pregnancy in those rural areas. During our meeting, Valley Health was asked by several participants what they would do to mitigate the problems the patients from Warren will have, especially those with few or no resources. Kathy Close from the Pregnancy Center read quotes collected from their clientele detailing their fears and the effect of the closure, including but not limited to a lack of transportation. Valley Health gave no replies to these questions. Their lack of acknowledgement of and mute response to the needs of our less well-to-do neighbors should concern us all. Which brings me back to my two main points. We should urge all concerned to press Valley Health to please partner with local and distant collaborators to continue safe OB care in Warren County. It can be done. We should also insist that Valley Health immediately work with all appropriate county agencies and regional resources to identify and address obstetrical and neonatal care issues which will occur after the closing of OB. In my opinion, it's their responsibility to take the lead since it's a result of their actions. Otherwise, the national statistics will have unfortunate local application, painfully noted by disadvantaged Warren County citizens. Thank you for letting me go a few seconds over.
That's fine. Thank you, sir. We appreciate it. Anybody else? Ms. Meltz?
Yes, Mr. Chairman. Ms. Amy Kearns?
Hi, good evening. Please bear with me. I'm a little nervous. Okay. Our meeting with Valley Health
State your
was-
name and address, please.
Oh, I'm so sorry.
It's okay. You're
Amy
nervous.
Kearns, 137 Lost Acres Lane, Stephen City, Virginia, right on the border of Warren. Our meeting with Valley Health was disconcerting. Valley Health and its staff gave anecdotes but no evidence, blanket statements instead of answers, and made excuses instead of working towards solutions. They know what the research shows, the possibility of mortality, but have not shown intentions of attempting to work with the community to correct the situation that they made untenable. Are they willing to sacrifice the health and welfare of the community, or is it about their bottom line? This town and its surrounding counties are growing. Winchester Medical Center may have the capacity to handle this now, but we don't know for how long. We are unlikely to be the exception to 40 years of research. We have heard the health risks from Dr. Kearns. I will not repeat them. But this is some of the effects on the town. We have gathered information from similar communities. Because of the complications and risks, there may be an escalation to health costs. Other aspects of women's health care, such as prevention, counseling, and gynecological, could begin to atrophy. Midwives in our community will not be able to practice because they need an OB unit to back them up. It could put a strain on physicians and nurses, which could cause burnout because the community will find it harder to attract and replace doctors and maternal nurses. Student nurses and resident physicians will choose to go elsewhere for their education, which will also put a strain on access to care. This is not just about maternal care. Emergency surgery and anesthetic surgeries can suffer because of the lack of physicians. Businesses could feel this burden too. They will find it difficult to recruit employees to a town that has limited medical services. Prospective businesses are less likely to set up shop in a community of this kind. People considering coming here or residents expanding their family may choose another town in which to settle due to the lack of care. Maternal and neonatal care is essential for the stability of the community, medically, socially, and economically. Valley Health is thinking about the short term, but our community needs to have a long-term plan. A recent study found that 70% of primary caretakers are women. limiting their healthcare access will impact everyone. This is not just about women's rights. It's about a quality of life. It's about our community. We are here with the hope that you realize we deserve equal access to healthcare, and you will help us find a way to at least compromise with Valley Health to come up with a solution. Thank you.
Thank you. Ms. Meltz?
Yes, Mr. Chairman, and I apologize if I mispronounce anyone's last names. Michelle Mathai? Dang it, I'm sorry.
Hello, good afternoon, or evening. My name is Michelle Matthey, and I reside at 364 Tulip Poplar Drive, Linden, Virginia. I'm on Blue Mountain. And I am the co-founder of Birth Local. I wanted to thank you today for taking the time to review our findings. Some of the research you may hear that we've done together, so you might hear some of the same things. I'll try to prevent too much overlap. We are presenting you with our research to help prevent the closure of our labor and delivery unit at War Memorial Hospital. We come to you because our pleas with Valley Health have been completely ignored. We intend to share with you the risks and effects these kinds of closures will have on the health and welfare of our town. You've heard what can happen to mother and infant, but it doesn't stop at mother and child. The truth is, losing our L&D unit has further-reaching consequences. Do you want this town to grow? Do you guys enjoy the new businesses and the new restaurants that are coming here? Because I do. But what happens if our town becomes a pass-by town, in which people opt to move where they can start a family and not have to deal with strangers delivering their bundle of joy, or family and friends traveling 30-plus minutes to care for or visit the new mom and infant? Imagine being separated from your child and having to find childcare for that whole time you're at the hospital. So if new families don't come here, will businesses choose to open here? Will current businesses be able to recruit and keep their new employees? Or keep employees? A study by the International Journal of Biometrology shows that a change in the barometric pressure brought on by a storm can cause a woman to go into labor. Because of this, during our snowy winters, moms that live on the mountains come to town, just in case they go into labor. They stay at our hotels, eat at our restaurants, and shops at our stores. We had over 500 babies born in Warren County just last year. And what happens when they choose another hospital in another town with other stores, and their restaurants? If moms don't want a stranger to deliver their baby, won't they then travel to other hospitals to keep the same doctor? And while they're there, wouldn't it make sense to also have the pediatrician and the family doctor there so all the appointments could be handled in one fell swoop? Again, remember, this was 500 babies. That's potentially 500 families if everybody only had one baby. If that happens, will our own OBs, pediatricians, and family doctors go out of business for lack of patients? I realize this may seem far-fetched, but I'd like for you to think about this in 3 years, 5 years, or 10 years from now. Our research has shown this does happen. Studies show that women make approximately 70 to 80% of their family's household health decisions. The moms Valley Health are turning away are the ones that will be making the decisions on where to send their sick kids, husbands, and aging parents. Labor and delivery is the way to create loyal patients. Valley Health stated they are committed to our welfare. However, they are closing L&D on May 1st, regardless of the consequences to our county and regardless of what the national statistics indicate. Our town will not be the exception to the rule. They say they can't recruit OBGYNs to our town, yet they are proudly stating just last night they are attracting new doctors with their new hospital. This is a wasted opportunity, and as a business owner myself, I can't help but see the dollar signs as they walk away. I ask that you hear us, your constituents, as we plea for your help. Thank you.
Thank you. Anybody else?
Yes, sir. Krista Adanich?
Good evening. My name is Krista Adnich. I reside at 9017 Stonewall Jackson Highway in Warren County. I'm a mother to 7 children, 5 of which were born at Warren Memorial Hospital. The care that I received there by the labor and delivery staff was exceptional. It was a wonderful experience. We're now being told that the labor and delivery unit will be shut down, but we are still going to receive the same level of care at Winchester Medical Center. And any women's care issues, which are emergencies, will be handled by the emergency department. In the medical field, there are often specialties of care: general family practice, cardiology, neurology, obstetrics. It's a specialty. There are reasons for these specializations, as emergency doctors are often good doctors, but they simply cannot know everything concerning every specialty of care. According to the Agency for Healthcare Research and Quality, in 2008, 94% of women had some sort of pregnancy complication. There were roughly 4 million babies born a year in the U.S., which is a staggering number. Granted, some of these complications are minor, like an umbilical cord around the neck, which approximate numbers show that's about 18% of births, according to their statistics. But some are not minor, like preeclampsia, which accounts for 3 to 5%, according to their statistics, of births, of pregnancies in the U.S., according to the National Institute of Health. If you take those 4 million babies born, multiply it by that 5%, you're looking at 200,000 babies, high-risk births, just for preeclampsia alone. That, divided by the number of counties in the U.S., of which there are 3,142, is 63 births per county per year that are high risk just for preeclampsia alone. Given not all U.S. counties have the same population density, you could expect that we would have a little more than 63. When mothers walk into an emergency department with a life-threatening emergency to themselves or to their babies because they cannot make it to a hospital, which could be 45 or more minutes away, what level of care are those women going to receive? Does the ER doctor have the experience to know what to do for preeclampsia or other conditions? Or does he need to go reference a book or computer system? This can cause a delay in care, which also increases risk. The truth is, it's more than just the doctors, it's the nurses who have to know. I know. I'm a nurse. I work for Valley Health. They are the ones doing the work in most cases. Do they have a specialization in mother-baby care? Yeah, they may have had a class in nursing school, but have they retained that knowledge? Again, this is why we have the specialties in healthcare, so patients can get the care that they need when they need it, and it can be care that is of quality. Like all things, this comes down to money. Valley Health is advertising for the cath lab and recruiting doctors for it. Is the labor and delivery unit chopped liver? Mark Merrill stated yesterday at the town council meeting that 60% of babies in Warren County are born elsewhere. If we have about 400 births annually at Warren Memorial Hospital, this means that there are more than twice this amount being born to families in our county. Warren Memorial Hospital is a diamond in the rough. The birth setting at the hospital here is what moms want. I'm a testament to that. It really needs to be advertised just like the cath lab. If they do the market analysis, it'll show. They're only capturing a third of the market in our county. It can grow. The effort just needs to be made. The question is, will Valley Health make the effort to do the business case? Thank you for your consideration, and anything that you can do in support of continuing care of women in our county would be greatly appreciated.
Thank you.
Thank you.
Ms. Mounts?
Yes, sir. Ms. Alicia Perko?
Good evening, Alicia Perko, 403 Ulysses Way in Linden. I am here as a concerned citizen and more importantly as a mother. 15 years ago, I had my youngest son at Warren Memorial Hospital. On the advice of my OBGYN that was in Winchester that I'd had for years, he told me to find a doctor locally in case there was an emergency. Ironically, I did in fact encounter an issue. Thankfully, within 30 minutes of waking up that morning, I was hooked up to machines and being monitored. If I had to go to Winchester, that same exact process would have taken well over an hour from where I live. Valley Health closing our labor and delivery unit does pose a threat to women's and infants' care by many things, but more importantly, time. As our county continues to grow at its current pace and the overextension of resources such as emergency services, we are facing possible tragedy. Valley Health has stated they will provide prenatal and postnatal care as they stated again last night. However, for 9 months, you're expected to go to doctors here, deliver your child in Winchester by a stranger, and then come back here for additional care? I wouldn't do that. I would take my business to Winchester, where I will be delivering my child. And there will be more mothers to do that. Valley Health has yet to provide definitive answers pertaining to emergency transportation, training, and many other concerns women have. So why should I be expected to put my family's well-being in their care? I implore the county to take action and stand up for its citizens' rights. I thank you for your time and your consideration and your help to achieve these goals.
Thank you.
Thank you.
Ms. Mounts?
Yes, sir. Kathy Close?
Thank you. I'm Kathy Close, 1023 Meadow Lane, and thank you for letting me have this opportunity to speak to you, to voice the concerns for the pregnant women in our community, especially the low-income ones. I'm the director of the Royal Pregnancy Center, and our center has been serving pregnant women, mostly low-income, since 1991. I'm here to speak for them. They will be the most negatively impacted by the closing of labor and delivery at the local hospital. We need to know what's the actual practical plan in place for getting poor women with limited transportation to the hospital when they have an emergency or are in labor. We are currently seeing at our little center 400 women every year. We did 132 ultrasound last year. So we're really familiar with the faces of the moms and the babies that are doing their best to prepare for bringing a child into the community. They are often for a short time low income. Right now, we have 14 moms that are due in May. They're due in May, and we have some that are due right just before May. And they're getting anxious about, they don't know which hospital they're going to be going to, and they don't know how they're going to get there if it's twice the distance that they anticipated. So we need a plan, not generalities from the hospital. Currently, moms walk to our center even in winter if that's what it takes to make sure that babies have formula. As Dr. Kearns mentioned, there's a recent JAMA study of 4.9 million rural births that said loss of hospital-based obstetric services in rural areas may prolong travel distances and affect access to and outcomes of care both during pregnancy and at the time of childbirth. And as Dr. Kearns mentioned, it also decreases prenatal visits when there's no labor and delivery nearby. The anxiety about getting to the hospital is already growing among our clients. So we called our clients for feedback on how not having a local labor and delivery unit will affect them. And this is what they said. I'm not sure how I would get there without a car. It will be an hour and 15-minute drive for me. This scares me. What if I can't make it there? I am home alone 14 hours a day with a 2-year-old. Neither myself nor my husband drive, and an ambulance will not transport my 2-year-old with me. My last baby was cared for at Memorial Hospital for a week. I will not be able to commute to Winchester this time if my new baby also needs to stay for a week. My baby didn't need a NICU, but I can't stay for a week or commute to Winchester. One client due the first week of May said, "I've already had to go to Winchester Hospital several times during this pregnancy, and they seem to rush you in and rush you out." So she wonders how will they manage all the additional hundreds possibly of deliveries. Another said, "I'll be surprised if I can make it to Winchester. With my last child, I had a very short labor." And she asks, who is looking out for my baby's interest? The fact that the hospital is offering classes for emergency medical services people to learn how to resuscitate newborns indicates that babies are at risk. So we need to ask the hospital what plan or coordination is in place to mitigate the harmful impacts that are likely to come to moms and babies most at risk. Can I go over a little slightly?
A little bit.
Okay, so I spent some time today trying to find out how they would get to the hospital if they were having an emergency. I talked to both Logisticare, which is Medicaid transport for women, and they said, give us 3 days' notice and you can sign up and we will transport you. But labor doesn't always give you 3 days' notice, nor do emergencies. So I talked to the Valley Medical Transport, and they said if a woman has to decide whether she's closer to Memorial or to Winchester, and she should go there. If she goes to Warren Memorial, the hospital will evaluate in the ER whether or not she should be shipped to Winchester, at which point they said, this is the Valley Transport people, that Warren would have to send a nurse with them because their paramedics are not delivering babies inside their transport. And if it took them longer than 30 minutes to get there, then the local hospital would need to call the local county people to transport. So, our clients need a plan. They deserve good care, and I think that our county should be looking out for their interests because these are the future children in our town. And sorry for going over.
That's okay.
But thank you.
Thank you. Who else wants to speak?
There's only
Can't
one.
we just have a?
There's only one other gentleman signed
No,
up.
that's fine. We're scheduled to have a public hearing at 7:30, but that's fine. We'd like to go ahead and allow the rest of the input here. Please come forward and state your name and address.
My name is Greg Bodo, 235 Biggs Drive. Those of you who missed the town council meeting last night missed quite a show. On the agenda was a rezoning request for the new hospital. Valley Health was there in force. So were the citizens of Front Royal and Warren County. The room was clearly divided. Concerned citizens on one side, Valley Health executives on the other. Valley Health's rezoning application had a serious problem. As required, they had submitted the so-called impact statement where they stated any impact to the citizens of the town of Front Royal and the surrounding areas can only be seen as a positive improvement. No mention was made of any impact whatsoever to our citizens. So for the first time in 20 years in Front Royal, I went to the podium to point out what I thought was a significant omission from this report. No mention is made about the closing of the L&D unit. I spoke about the impact on my employees and the impact on our community's ability to attract new businesses. Then, like tonight, other citizens went to the podium, many to address the impact on less fortunate members of our community. Did the council hear our citizens? Did the council reject the application that clearly failed to disclose impacts as required? Did the council enforce town code and uphold the integrity of the rezoning process? No, they did not. Incredibly, they said the rezoning application conformed to their standards, despite the fact that the impact statement appeared to have been written by the Valley Health's marketing department. The council thanked us, offered their platitudes, and then, in what can only be described as a rehearsed vote, squandered our best opportunity to get Valley Health to the table for a discussion. I don't understand Front Royal politics, But I do know that this issue has universal appeal among our community. I've spoken to several fellow businessmen, business owners in Front Royal and Warren County about Valley Health's decision. Those who did not know were shocked. Those who knew quickly shared their concerns as well. Time is running out. We need Valley Health to address the impact of closing this unit and to work with us to find solutions. We are reasonable people. We are willing to discuss alternatives. But we do need Valley Health to come to the table. We're not looking for platitudes tonight. We're looking for action. Put this topic on your agenda. Provide the leadership you promised when you were elected. And please stand with your community on this issue. Thank you.
Thank you. Is there anybody else that didn't sign up would care to come forward? Okay, just, we appreciate everybody coming here tonight. This has been going on. From this board's perspective, when they came to us, I think the first meeting in January, asking for, to give them approve a certificate of need to build a new hospital. And at that point, that was the primary concern because the current hospital is landlocked. That issue at that time, I don't think, we were made aware of it, but I don't believe that, it was actually the primary reason for them being here. However, we did send a letter of support for the new hospital. In addition, we also sent a separate letter urging them to reconsider closing the L&D here in Warren County. So I think in some respects, we have been ahead of the curve. There's nothing that Valley Health needs from the county as far as rezoning those things, since it is located in the town. We can resend that letter again. I'm not sure what else it is that we can do, but, I think it is important to have an L&D here. But again, those decisions are not made by this board, and we have very little impact as far as what can be done. Certainly willing to listen to any suggestions you may have that we could do. But at this point, I would suggest to Mr. Stanley, if this board's okay with it, that we go ahead and resend that letter and just ask them to reconsider and show what they can do to be more responsive to the community. So